The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is the Planning Commission's June 24th virtual information brown bag quarterly. And we're thrilled that you all were able to join us. I'm Melissa Zornita. For those who I don't know, I'm the Executive Director of the Hillsborough County City-County Planning Commission, which does the long-range planning for Hillsborough County and the three municipalities, City of Tampa, Temple Terrace, and Plant City. So we put together some informational webinar sessions like this on a quarterly basis, and we're really thrilled today to have what I think is a very timely topic about how our community, cities, and mobilities will change post-COVID-19. Hopefully everyone is safely and well at home, and you've been able to grab something to eat as you watch our discussion today. We have two speakers from the University of South Florida's School of Public Affairs Masters in Urban and Regional Planning program. And the plan for the webinar is that each of them will make a presentation. While they're presenting, if as you hear it, you have a question that pops up in the box on the GoToWebinar screen, you should see a space for typing in questions or chat. And we'll collect the questions or if there are comments in the chat box, and make sure there's time to address as many of them as we can at the end of the two presentations. So our first speaker today is going to be Associate Professor Dr. Elizabeth Strom. She has previously served as the Director of USF's Office of Community Engagement and Partnerships. Dr. Strom has published on urban development and affordable housing in a number of journals, including Urban Affairs Review, Journal of Urban Affairs, and Housing and Policy Debates. She's the author of two books, Building the New Berlin, The Politics of Urban Development in Germany's Capital, and The Urban Politics Reader. She's worked with graduate students on a number of projects that are specific to the Tampa Bay area, needs assessment for affordable housing in Dunedin, and a needs assessment for Sulphur Springs and the East Tampa neighborhoods. Our second speaker today is Assistant Professor Dr. Peng Chen. He has an interdisciplinary background in urban planning, transportation engineering, human geography, and statistics. And his research relies heavily on qualitative analysis, especially spatial regression and time series analysis, which I won't pretend that I understand all of that, but he's going to help us understand it, hopefully, some of that. Dr. Chen has published articles in top transportation planning journals, such as Transportation Research, Part A, Policy and Practice, Journal of Transport Geography, Journal of Transport and Land Use, and Urban Studies. He's also served the academic community by acting as a reviewer for journals and was awarded Best Paper for Session F, Transportation and Land Use at the 14th World Conference on Transport Research. So we've got some very esteemed speakers here today. We're thrilled they're able to join us virtually. And with that, I'll turn it over to Dr. Strom.
Thank you so much, Melissa. It's just a pleasure to be here. I'm sorry I can't see all of you, but it's great to be able to present in this forum. Yeah, I'm going to be talking about cities after COVID. I think that this presentation kind of started as a bit of a rant where I was reading about how, cities are the problem. That's why people are getting sick, and we need to give up on this idea that cities are good places and encourage people to live in cities. And so I try to give some thought to what a counter argument would be, because as you know, for planners, we often emphasize the importance of promoting compact cities with dense urban cores. We do that because we understand that a future that is sprawl and suburbanization has consequences for equity and consequences for the environment. And so we really don't want the narrative coming out of this pandemic to be that all of that was a bad idea, and now we need to go back to sort of letting development just sprawl out as broadly as possible. So first, let me think for a second about why it is that planners care about density. I'd say it's because we understand that density allows us to replace long auto commutes with transit trips or walks, and that's good for the environment. It may seem counterintuitive, but we know that dense is actually greener than the alternatives. If we plan our communities so that we all live a little bit closer together, we can preserve those green spaces and wilderness areas at the edge of the metro region. We also know that density is the key to producing affordable housing. First of all, it costs an estimated $8,500 a year to own and operate a private car. So dense communities that support transit or walking can allow families to save thousands on their cars, and that helps them afford their housing. It's also very hard to produce affordable housing of any kind if you can't use land efficiently. How affordable can a unit be if you can only build 2 or 3 on an acre? Indeed, the foes of affordable housing frequently use single-family and other low-density zoning as a barrier to keep out more affordable options. Density, which is a hallmark of our cities, is therefore so important to anyone promoting sustainable and equitable communities. Now, clearly there are some reasons why those initial days of COVID shutdowns made city living look bad. First of all, New York City really dominated the news for those first few weeks, and they had a terrible experience with COVID. And so the difficulties of the New York area gave rise to the idea that you see cities are dangerous places to live. Secondly, although there's much we still don't know about how coronavirus spreads, we knew much less back in March. And there were fears that even the most glancing kind of contact could lead to infection. And that left us feeling like cities must be scary places. If we just simply pass someone on the sidewalk, we'd be at risk of infection. I think it's clear now that outdoor transmission is rare and that fleeting proximity is unlikely to be harmful. Finally, never leaving home has a different level of inconvenience if you live in a small apartment versus living in a larger house with a nice yard. And the latter kind of housing is simply more abundant in suburban areas. Nonetheless, while I understand where those ideas came from, I still find it disturbing how much talk there's been since then about how cities are the problem. Now, some of that talk, let's be honest, it comes from commentators who really didn't like cities much to start with. These are people who have been thinking of cities as problematic and pushing for more suburban kinds of approaches to development, or NIMBY advocates who've been fighting against density for various reasons. Just for an example, you may know that California, where housing prices are insanely high, has been battling over legislation that would have permitted higher density housing, especially near transit. Well, we were just maybe 2 or 3 weeks into the pandemic when I saw this headline here, where talking about how density opponents, NIMBY people in California, were already saying, well, see, this pandemic means that density is dead, and it proves that it was wrong-headed to think that we should build more densely. Now, I think it's really too early to say whether there's been any shift in where people live or where they want to live based on COVID-19, but it's not too early to work to counter a narrative that tries to make cities themselves the problem. So we just need to be clear that living in cities or living in dense residential communities is not in and of itself a high risk factor for the spread of the disease. First, let's take a look at COVID hotspots. Obviously, cities certainly have higher numbers of cases, but are you more likely to be infected if you live in a city? Well, again, let's look at New York. New York is like the worst case scenario. 22,000 deaths and counting since the coronavirus pandemic started. But there's so many other dense cities that have not had that experience. Internationally, we look to Hong Kong or Seoul. Any city in Germany has done better than just about any city in the United States, and certainly New York. But even in the US, we see examples like San Francisco, which is also pretty dense. They, as of last week, had 46 deaths. Then we need to look beyond raw numbers to see whether those areas of greater density are actually more likely to result in people getting sick than in less dense areas. So this is a map of New York City with my terrible effort to make arrows, which didn't turn out, but you sort of get the idea that this is Manhattan. Manhattan has the highest population density in all of the 5 boroughs of New York, but yet look at where cases are concentrated. They're not in Manhattan. They're in what are called the outer boroughs. This is Queens, the Bronx, and Staten Island over here. And I call your attention to Staten Island because Staten Island is the least densely developed part of New York. It has kind of a suburban land use pattern with more single family homes. And yet look at the per capita, I'm sorry, these aren't per capita, these are just zip code counts for infections in New York City. And so you have to ask, why are infections so high in the least dense part of the city? And I think what's clear is that it's not population density per se that leads to higher rates of infection. It has much more to do with poverty, working class families, essential workers who can't work from home, and that explains the differential in risk factors. If we look nationally, if you recall the early days of the pandemic, as the virus spread, some of the earliest hotspots were actually suburban, around a Kirkland, Washington nursing home and a New Rochelle, New York religious congregation. And now when we look at the areas with the most cases per capita, outside of here's the New York area, which still does have high infection rates, but look at where the other high rates are. We see it here in New Mexico and Arizona. That would be Navajo country. We see hotspots here in Nebraska, Iowa, Minnesota, often around meatpacking plants, prisons, and then the entire what we tend to call the Black Belt region of the South, an area of high rates of poverty, also has very high rates of infection when you look at it on a per capita basis. Now let's look at Florida. We know that Florida has seen very high numbers of cases in the Miami area. We know that recently cases have spiked in Tampa and Pinellas County and the Tampa Bay region more generally. But when we look at it per capita, we get a very different picture. This is Liberty County that has over 1 in 50 people infected. I pulled this map last week. By now, this is Hamilton County up here, also is red by now. And even with our higher infection rates, some of our metro areas still on a per capita basis are much safer places to be than places like DeSoto County, which have high rates of infection. And I think this is really noteworthy. Recently, there's been more attention paid to high infection rates among agricultural workers, which I think explains some of the high rates here. Now, unfortunately, our governor discussed this as though the workers themselves were at fault, which was a really terrible way to frame this problem. But as we'll discuss further below, people are at higher risk when they don't have the luxury of working from home and distancing from others, and that's certainly true of agricultural workers. Now, my colleague, Dr. Chen, has expertise in transportation planning that I don't have, and I'm going to leave much of the talk of transportation to him. But I just wanted to note something about transit, because I think, for some cities that are heavily transit dependent, transit certainly could have been a vector for infection in the early days. People weren't wearing masks. It was very crowded. But I do want to note that transit doesn't have to be a vector for infection, that there are best practices that make transit safe even during a pandemic. So I don't want the discourse to be that, well, density is bad because densities are transit dependent, and of course going on transit will make you sick. People wearing masks, reducing some of the congestion, this is all going to help reduce any risks of transmission. And I understand that's a lot to ask. Most transit systems aren't trying to have delays. They aren't trying to have infrequent head times. But I think it's important to note what best practices would look like. The idea that the takeaway from this crisis should be, please let's have more cars, is a scary one for anyone who understands how private single driver autos imperil the environment. We're starting to see some published research that tries to identify characteristics of communities that have higher or lower infection and death rates. Here is one study just published online. And they find some expected results, that a county's racial composition affects COVID outcomes. They also find that counties in very populous metro areas have higher infection rates, but population density within the county does not lead to higher infections. need death rates in higher density counties. This may be a function of better healthcare infrastructure. Now, the authors note important caveats that confound any effort to speak definitively about this pandemic. It's such early days. Our numbers are only as good as our testing capacity, and also it's a moving target. So today's success story could be tomorrow's hotspot. But at first glance, it appears that higher population densities don't push infection rates up. What's clear is that the virus thrives with crowding, which is not the same as residential density. Crowding can occur in institutions like nursing homes or prisons, or even churches and concert halls, and these have been associated with the spread of the disease. Also, crowding is a feature of the housing of poor and working class households, where having one's bedroom or even bathroom of one's own is an unheard of luxury. An untold aspect of high infection and death rates in some of our hotspots has been the spread of the virus within families, in households where an infected member simply can't self-isolate. In contrast, intra-household spread has been much less aggressive among more affluent families. So trying to look ahead, which is what we do as planners, there are a few things we can think about. And so first is the thought, the idea that city dwellers who can afford it will immediately depart for the suburbs or for exurban areas where shelter in place is less constraining. But shelter in place in dense neighborhoods is only really problematic if people live in crowded quarters or in housing that is low on amenities or have limited access to open space. This seems to me to be a call to ensure that housing and public spaces are designed so that so that environments can be pleasant and places to quarantine. Just having a small balcony or patio can make a huge difference if you need to stay home. Looking at public spaces, I think the early reaction in some communities to shut down parks was the wrong one and did indeed leave those without private yards at a real disadvantage. But on the other hand, I applaud cities that have to close some roads to cars to give people more room to walk and bike, and I hope we see more of that. I think thinking about the quality of life in urban areas isn't just something we do for pandemics. It's an issue we can think about all the time, but it definitely makes it easier to shelter in place. And what about the claim that we've seen the last of the traditional office? If there are major shifts in where people work, won't that have implications for urban land use and therefore how we plan cities? I would not jump to that conclusion just yet. Certainly some businesses may realize they can operate smoothly without a traditional office, but this is likely to depend on how quickly we revert to something close to normal, as well as the nature of each workplace. Also, I don't know that work from home means the end of cities. Obviously, if you can work from home, you don't need to live near where you work. And so some people assume that means people will just rush for the suburbs. But I suspect remote workers may not want to be isolated or car dependent. And I don't think it's self-evident that those liberated from commuting will opt for the suburbs. Indeed, work from home could make urban amenities, the coffee shop, cultural institutions, places to meet with friends, even more desirable. Now, I could see work from home free people from very expensive cities, from the San Franciscos and the New Yorks and the Bostons. But it doesn't mean they won't want cities. And indeed, I think this could be a boon for places like Tampa and St. Pete, which are amenity rich, but relatively modest in their housing costs. Let's remember that those of us who have advocated for dense, compact cities haven't done so though for aesthetic or lifestyle reasons. We've done it because we understand the cost of sprawl. We understand that auto dependence requires us to continually build new highways at the cost of wildlife habitat and air and water quality. We understand that 25% of all greenhouse gases are associated with auto commutes. We know that driving creates its own safety concerns and diminishes quality of life. We know that only through density can we produce affordable housing for diverse populations. An estimated 20,000 new residents will move to Florida each month in the coming years, according to state estimates. If we buy into the idea that cities are unsafe because of COVID-19, We will acquiesce to new auto-dependent development at the fringe of our metropolitan areas. We will turn our back on issues of climate change. We will ignore problems of economic and racial segregation. So it is really important. We do not want to let a false narrative about COVID-19 shape planning practice moving forward. Thank you very much. This is a picture of where I used to live in Vienna, just an example of a nice compact city that has basically eliminated its COVID crisis. And so I kind of look at that as aspirational for us in Florida. Thank you.
We'll go right to Dr. Chen, and then we'll take questions at the end of both of the presentations. So Dr. Chen, if you're ready with your PowerPoint, great.
Okay, so how are you today? My topic is more about mobility because my field is transportation planning. And I also want to acknowledge that some of my slides are directly adopted from the Professor Robert Lawland from the Rutgers University. So during the recent a few days, just quite recently, we see a great increase in the number of cases infected in both Florida State and also Pittsburgh County. To me, I agree with Liz is that it might related to the protests and also related to the reopen of the economy, but it may not really that much connecting to density, especially when comparing Hong Kong and New York. Actually, because I'm coming from Asian countries and I know how dense they are, but actually because those countries and cities, they aggressively tracking people's contact tracing. So somehow that can prevent people from contacting each other and prevent the spread of the COVID-19. So I agree with Liz that density may not be really guilty, and we cannot give up density and transit use because of this virus. So after the spread of this COVID-19, actually we see the great reduction in vehicle mass traveled. We see reduced transit use. We see reduced shared mobility, and we see reduced tax revenue from the transportation part. But we also have to notice all these things are quite normal when economic recession happens. So if we look at changes in mobility, no matter for retail or recreation, grocery stores, parks, transit stations, and workplaces, they all experienced decline during the past 2 months, except for the residential area, we see some increase. And this is in April and then May. And this is more recent one. We see because of reopening of the economy, it's kind of back to normal, no matter for the retail, for grocery store, for parks, transit, and workplaces. And even for residential, the increase is decreased because people exercising and working in their neighborhood. But right now, because they have spent more time outside their neighborhood, and this part is reduced. This is the numbers for Pittsburgh County. And if we look at what we have for Tampa, so this is one outlier, so we don't have to count. We can see that for driving and working, actually, after we reopen the economy, it's almost back into normal, except the transit use stays low, and the same pattern for both New York and Miami. So after we open the economy, things back to normal, and then the transit, the mobility part actually is somehow back up. So right now it's a kind of national requirement that people have to wear face masks to ride the transit, but because before we really have this requirement, Pittsburgh County has two bus drivers being tested positive for the COVID-19. And also, like New York, right now is facing a great challenge in terms of the funding, because it faced around 4 billion bore out. And many people have the fear and the concern about in this kind of crowded environment, and they have the fear of using transit. In terms of shared mode, at least the Uber and the Lyft has a lot of challenges right now. Even they provide disinfectant and face masks to their drivers, but many people don't want to take a ride. And also for the other shared vehicles like Lyft car, Car2Go, right now people don't use it. And Uber lay off around 3,000 employees in recently. And also in Canada, several car sharing programs closed because of it's kind of bankrupted. But another good thing happened is about shared bike, because this can somehow help you to keep the social distance. And also, as Liz said, in the open environment is okay. So in New York, the city bike is quickly expanding. A lot of new bike stations are installed. So this is things happen for bicycles. And also for working, right now, people tend to keep the social distance. And right now, we have an opportunity to see how much the street space is devoted to cars. In terms of telecommuting, usually we just have 5% of workers, they can work from home. And most people have to work on site. But right now, because of COVID-19, around 25% people right now, they can work at home. But this also leads us to the development of some technology like Room and other telecommuting conferencing techniques. But also other concerns have. So employers need to evaluate whether the productivity can be maintained at same level, and whether people have to search out other ways to relieve their stress when they're working from home. So other things we need to look at. But telecommuting actually, even back to normal, is a good way to reduce the peak hour congestion. So I think this part should be encouraged. And in terms of the delivery things, so Amazon actually is one company quite successful right now, and they are hiring people for both warehouse shoppers, because delivery is right now is really developed on this part, and online shopping is increased. So back to the question that Liz has already been discussed a lot is about the density. So for my part, I also agree with Liz that density is not guilty. And also Florida actually is famous for spoiled area. So the density here is far lower than New York, than San Francisco, than Seattle. And even compared to Asian countries, the density is much, much lower, and also compared to European country. So I don't think density is a big concern, but the way how we tackle with this COVID-19 is the more important issue. So those policies, when to encourage people to stay at home, when to wear face masks, this policy is very important. I know some people right now, they think about relocate to other low density area, but then maybe more people want to move to Florida, and then how we can handle this new residents. But also from my part, I think when people think about relocation, it has to depend on whether they have the job here. Otherwise, if they don't have a job, they cannot really afford housing here. So in terms of revenue and spending, this economic recession that result in a great loss in the gas tax, tolls, and other transportation revenue. So it will be very challenging for the next year in terms of transportation funding. Congress may act a large infrastructure spending bill to cover this part. So I have some thinking. So telecommuting may need to maintain for a while, because somehow we have so many people infected, and I think it's a little rush to reopen the economy. In terms of transit, so I think for this kind of large vehicle, very crowded transit may not be quite attractive at this moment, but we still can think about some paratransit, microtransit, on-demand transit, and they can integrate with shared mobility modes, and also to cap the capacity, and also to ensure when people are sitting in a car for certain distance, I think transit still can be used. And in terms of density and relocation, I don't think density is really guilty on this part, especially for area like Florida. We don't need to really have the big concern on this part. In terms of gas tax and tolls, yes, we have a tough period to experience. So that's all my lectures. And if you have any questions, feel free to ask.
Hey,
Okay.
thank you so much. So we can move into the question portion. I think we have a couple in the chat, but if you think of any in the meantime, please feel free to enter them into the question box. So the first one says there's a good analysis of what the initial impact has been on different land uses and on transit. But what of those changes do you think will stick?
You mean both for land use and also transit, right?
Mhm.
So for transit part, actually, especially for region like Florida and for city like Tampa, we know that transit is significantly subsidized, and also sometimes it's not efficient. And right now, actually, we have a change towards using paratransit and micro transit. Basically, we use smaller buses. And also it depends on people's demand. So like in peak hours, we may provide fixed routes, but non-peak hours, we may have more flexible routes, and residents can using smartphone apps, and also maybe can be provided with some incentives, and then people can get this kind of door-to-door mobility services rather than they have to work or bike to the bus station or the bus stop. So that can somehow can be something may happen in the near future. That can also make the transit funding more efficiently used and serve more people, make people feel happy, and maybe more people can give up their cars. In terms of density part, actually, I think because we are getting more people coming this region, so maybe TOD is an option we may think about in the future, and to provide more affordable housing and make people have good access to paratransit, microtransit, and I think that's something happy for the future.
So I think that so much of how much things change depend on how long this goes on. And so, if we get effective COVID treatments or, please, a vaccine in the next 4 or 5 months, then I feel like things are going to return to kind of the way they were. Maybe they'll be different at the margins. Like for those of you who are listening, then, many of you are working from home now. Think about your own employment situation. Do you think you'll come out of this with your employer saying, that worked so well, why have an office? We're giving up our lease. Do you expect those wholesale changes, or do you think that it'll be, if this has only been a disruption of a few months, people just sort of go back to work in the normal way? So I think timing here means a lot. I've lived through a lot of things that were going to change cities irreparably. I mean, if you think about, remember after 9/11, a really tragic thing that happened in New York City, there was a lot of talk that nobody will live in cities anymore. I mean, clearly that's where terrorists are attacking. And so that was going to produce this huge wave of suburbanization, and I don't think that happened. And so I think people's behavior and economic kinds of forces are more elastic than we imagine. But if this were to continue for a full year or beyond, then I do think you're going to see more lasting changes in land use, where companies need to decide about renewing those leases, and then employees need to make decisions about where to live based on that. I think also we have to remember that for all of those of us who are working comfortably and safely from home, how many people don't have that option? And so I do wonder what will mean for equity, in that people who have to come to work, and they range from, people who are cleaning offices or doing your nails, to people who are surgeons and have more high-level jobs where they need to be physically present. What kind of equity gaps is it going to produce, where some people are kind of free to go, live in Boulder, Colorado, because who wouldn't live in Boulder, Colorado if you could live anywhere in the world? Whereas other people still need to be close to that hospital or to that work site. And so those are things I think we need to keep in mind.
Great. So we have one other question. It says, are there any new uses or industries that you are seeing emerge since the pandemic?
Vaccine, and also the other techniques can help people telecommuting, and the teleconferencing can facilitate working from home. I think these are the new industries people need to think about. Yeah.
Right, and so yeah, I think anything related to remote work, I think anything that can be turned into something you do remotely. I would imagine, those of us who can't go to the gym have discovered various, apps for exercising, and I understand that simply downloading it onto my iPad. Really, I spend so many calories doing that I don't actually need to ever use the app. I'm healthier just for having done the download. So I would think those things, anything that can be done remotely, would definitely, I think, be gain. I would also, I think it's sort of interesting to think about how this changes the need for healthcare workers, because on the one hand, there seems to be such a need for healthcare workers. On the other hand, because I've also heard that there are places where healthcare workers have been laid off both because of need to keep beds available and fear of COVID, people are not doing sort of elective or routine kinds of surgeries and treatments. And so I wonder whether there's a way to redeploy healthcare workers away from like cosmetic surgery to something more dealing with infectious diseases, and to redeploy workers who worked in restaurants that are closing so that they're now providing meals for nursing homes and hospitals. So I think there needs to be some thought. It seems like there's needs for many things at the same time that other things that we were doing aren't being done anymore. And so I wonder if there are ways to redeploy workers into areas where they're using similar skills and don't need it to be entirely retrained, because it can help overcome some of the problems we're seeing that are leading to widespread unemployment.
Okay, our next question is, how will changing transportation usage change the models and demands for parking, highways, and transportation hubs?
So this actually is connecting to the future, especially for the parking part. So right now we really have a hot topic on autonomous vehicle. So if we really have this kind of autonomous vehicle coming into reality, and if we have more personalized services, like you can get a ride just using a smartphone and everything can be packaged. And then that actually, a lot of people don't want to use their car anymore. The shared mobility can really bring into the reality many households and share the car, and then we don't need that much parking space. And the cars can park themselves no matter in the downtown area or in the suburban area. So we don't need that much parking space in the dense area, and this land can be reused for like parks or recreation area, or even can be rebuilt as for offices. So but we don't know when this will come, maybe 20 years, 30 years, but maybe 10 years. Not quite sure right now, but actually we have so many universities in the US now operating autonomous vehicle, and hopefully one day it will really work in the road. So hopefully this gives you the answer.
I had a question. It's something that we've sort of been seeing for a while, has been the shift in retail markets and I mean, we used to have tons of bookstores, and now everyone buys books on Amazon, so there aren't very many, which makes me sad. But so I guess what might you be seeing in terms of changes in the retail market? And then as planners, what should we be thinking about how to, and what might be some of the opportunities, if you've thought about it, to adaptively reuse some of that space and rethink what role retail has in our communities?
I'll take a stab at that. So I think that it's furthering trends, Melissa, as you know, didn't come out of nowhere, that we've been moving away from brick and mortar retail for a while. In particular, I think those big box stores and big shopping malls have been feeling a huge pinch. I think especially, if I understand correctly, sort of the big, the traditional shopping mall with the Dillards at one end and the Sears at the other end. I mean, those malls have been struggling for a while. And so this is going to accelerate those trends, but also hit mom and pop retail in a way that we may see as more problematic. So it seems to me that what we're seeing is retail space used more for experiential sorts of things. And that could mean plain old retail, but it's been a while now that I think we've noticed how many stores they do more than just, have, if it's a bookstore, they have a coffee shop. If it's a sneaker store, they have places you can test the sneakers. I mean, I think that successful retailers are understanding how to make shopping into an experience that you can't get from home, because they have to give you a reason to leave home. And so I would imagine that the retail that survives will be good at that, at making retail shopping into something that's part of our entertainment lives and our social lives, and not just kind of a buying toilet paper lives. So they'll definitely need to do that. But it's not clear to me that there'll be enough demand for that sort of retail to keep our downtowns vibrant. And it's kind of sad in that we've struggled in a way to bring some impetus back to downtown. And not every downtown retail space can be a coffee shop or a restaurant. And so I think it takes some creativity to think what goes in those places. And I'll just mention that I think what might be a mistake, and this may just be kind of pie in the sky and hard to realize at a place like Florida, I think the idea that the market will manage this just fine is a mistaken idea. I think the market by itself will not give us appealing, diverse retail in our core areas. And what I do recall from when I was living in Vienna is they even had a program for what in German it basically is called like ground floor management. Like if they started a new development, they knew there weren't enough people living there to produce street traffic that would keep stores going. But if you move there and there's no stores, it's depressing and you don't want to move there. And so they had a program where they kind of managed the ground floors using public subsidies, keeping rents low, kind of easing rents into when the population picked up. I don't know the specific mechanisms, but it seemed to me an acknowledgement that retail is kind of a public good. And that in order to get retail, we need to cultivate it the same way we might cultivate museums and parks and performing arts centers. We don't expect the market to provide those. So it may be that we have to be thoughtful about ways we can plan for and help promote retail other than just saying, well, we'll let the market run its course.
I think I agree with Lee's comment, and I just want to add some thinking from my part is somehow I think it's time for those retail store to think about how to make the change. Especially, they should provide something different from online shopping. So like provide different experience, as Lee said. They should somehow differentiate themselves from online grocery stores, provide something unique, and then that may attract the customers. And also, I think like this is the government's part is somehow to protect the local business. So still some people, not all people do online grocery shopping. So like especially the elder people, they may not be very comfortable of using the internet. So for sure, we have certain stores and we have, I mean, they can be treated as disadvantaged groups and they need those stores to survive. So somehow the government is thinking about subsidies to help these stores to survive, then serving to certain people. So some people, they cannot scan the QR code, they don't have the email account, they cannot do this kind of online banking. So I think this is also the government's part, the responsibility to keep certain, at least a one type store for one city, so people have a place to go.
Yeah. Well, and this transformation of the to more delivery things has I would think, a big transportation impact as well. I see a lot more Amazon trucks in my neighborhood. Yeah. So it's a different kind of transportation issue that we might be faced with in the future.
Yeah. So some people change their jobs. They can change from retail store sellers to delivery people. Yeah. So people can change their jobs. Yeah. Mm-hmm. So the store can make the change. People can make the change, but also governments need to make the change.
Yeah. Yeah. I think
we have a couple more questions. So next says, do you think that now is a good time to leverage an emphasis on equity to stem inefficient sprawl for poor people who cannot afford those homes or to own a car and commute?
Well, thank you, whoever asked this question, because I think this is really crucial. And I think it's so counterintuitive because cities are broke, everyone's broke, but it's when things at times like this is when we need to be creating community land trusts and buying up everything we can get our hands on. We should have done more of that in 2008 and 2009, and it's what we should be doing now. I think, first of all, to me, the COVID crisis has brought home in such dramatic and concrete terms what inequality means, because our chances of getting this disease and our chances of dying of this disease are so absolutely tied to our socioeconomic status, tied to age as well. Certainly being very old happens to all of us, but otherwise socioeconomic status is so tied to whether we have a lot to fear from COVID. And I feel like every day when I wake up and I'm healthy and in my nice house and working from home, I really think about how my position in life has made me very safe from this disease, and how unfair it is that for some people that is not the case. So I think that it does give us the opportunity to think about this, to think about what it means to shelter in place in a small apartment with limited windows and with 5 people and in 2 bedrooms. But it also gives us an opportunity to act, because there are going to be places that go into foreclosure, and rather than wait for hedge funds to buy them up, we can be thinking about how we can turn them into community assets. Luckily, just to be very specific, so far at least, the legislature and the governor did not sweep the Housing Trust Fund money this year. It's a miracle, but let's run with it. There's actually money coming from the federal government through the CARES Act, some of which is going to emergency aid right now, but some of it is not, and it could be used for things like land banking. I believe that there's some flexibility in the CDBG money. So I think absolutely seeing this crisis as something we need to manage, but then also that we need to set ourselves up so that when we come out of it, things aren't just back to normal, but they're better than they were. I think that is really an imperative, and as planners, we're supposed to be thinking ahead, and this is the thinking ahead we need to do.
Okay, I think Lee's answer is fantastic. So,
okay, our next question asks: many of us are negotiating entitlements for major developments now, and those transportation obligations. How do you expect the market to modify traditional transportation obligations for ongoing developments?
For myself, I can't say I understand enough about the entitlement process to answer that. I don't know if Dr. Chen has studied that, but I have to pass. I'm sorry.
This is really a challenging question. So if I answer your question correctly, is how to integrate the transportation and land use developments together.
I think where they might be going is that because there's so much change in the transportation demand that a development might. So normally, like somebody wants to build 100 houses, we ask them to, run a transportation study and tell us, well, this is going to put this many cars on the road. But is it really? Like, I think that's kind of
okay. So to me, so I would take, because like for land use change, actually it takes a long time, but for transportation change, actually this part is quite quick. So we see the grid shrink like transit is reduced like 80%, and about just 1 month ago. And for the driving part is reduced by half of the people, they don't drive. But this is only temporal. When we're back to normal, those roads will be still congested. And what we are experiencing right now, like telecommuting, actually, if some people keep this habit as telecommuting, after when we have the vaccine, everything is back to normal, actually we benefit from telecommuting. Somehow the congestion is reduced. And if we have this kind of new development around the transit area, if we change from the traditional transit to paratransit, microtransit, and then people can better serve. And then maybe more people are willing to move to high density areas because they have transit accessible. That can somehow also help reduce congestion. So I think the travel demand right now, we don't see many congestions, we don't see many cars on the street, but I think this is only temporal, maybe maintained for half year to 1 year. But after that, we still see congestion. And telecommuting actually is helping, developing microtransit actually is helping. So I don't take this as a kind of very serious concern. After everything is back to normal, we benefit from these changes.
Yeah, I know we've talked in our office for years about transportation demand management strategies, and this has kind of forced them all to happen right at once.
Yeah,
But
yeah.
but this is something that, since it's been so successful, we're considering how we could implement it on a more regular basis, allowing people to work from home 2 to 3 days a week, not, we're as a public.
Yeah. So
You gotta
work
be
10
there for the
hours
public.
per day, but it can change to work 4 days per week. That can help to reduce the peak hour congestion.
Yeah.
And also help people to leave earlier or leave later, and also can help to reduce the congestion. So I think we have other travel demand management tools to change, rather than just using the very conventional method to do the forecasting. People can change their behavior based on the circumstance. So that may something happen in the future.
Yeah. Thought it was really interesting how you said, Liz, the longer this lasts, the more we might make some of these changes permanent. Because I think that's really true. They say it takes, what, 30 days to create a habit, something like that. Like,
Right.
the more 30 days we have, the more these things might feel like habits and not the.
Absolutely, and we have so much sunk cost in an infrastructure that was, a pre-COVID mode. So I think that the tendency to flow back into that will be very strong, unless this has gone on so long that we really are making more substantial changes. As I said, if you're a company and your lease is up at the end of 2020, do you renew it and have an empty office for another year or two, or do you cancel it? And so when you see some of those changes going on where people are really making decisions, then you'll start to see real estate markets change, and then land use change as well.
Mm-hmm.
Yeah, I agree. So right now, actually, my recent research is working on how personalized incentive can encourage people to use shared cars. So the result shows that about 130 days, if we continue providing incentives to people, and some people shape the habit of using shared cars, and they become insensitive to those coupons. But some people, they just can, once you remove those coupons, they went back to their original behavior, but still some people choose the change. So as long as some people are willing to make the change, then we can benefit and make this a policy that can help the transportation system.
Yeah. One area that I think you touched on a bit, Dr. Chen, and it kind of relates to something, well, it relates to things you both said. The idea of our streets as public space and the need to recreate. I know, Dr. Strom, I saw something you had written about opening back up the parks, and but do you think we'll start to see a shift in how we utilize that part of our public space to be less about cars, maybe? Maybe that's the planner being hopeful.
So yeah, I think I had written an op-ed in the Tampa Bay Times because it really annoyed me that they closed parks and then you had all these empty streets, including some streets. I mean, some streets are going to pick up again, but like if you know all your schools are closed, there's some streets that basically their function is to bring people to schools. Their function is to bring people to stadiums that are closed for the long haul. And so I don't really understand why we're not sort of thinking about reusing that space. I mean, it's kind of I didn't come up with the idea. All planners are aware of how much of our urban footprint we give over to cars, and exclusively to cars because cars can't share. And then when you start having less traffic in places that are not being used at all, I feel like one of the first things we should be doing is how can we shuffle things around, especially when we first went into shutdown mode. It was March. It was really nice here. Everyone should have been outdoors all the time. We would have all been safer. We would have all been healthier. But parks were closed. Streets still had the random car on them. And so we see now that streets are being reconfigured to have outdoor seating for restaurants. And I mean, that may be the sort of thing where now that we are doing it, no one notices that they can't park their cars there anymore, and it becomes sort of de facto in places like St. Peter or Ybor City moving forward. We just sort of never give those areas back to cars. But there are a lot of cities that have done it in much more robust ways than we have. You know, especially any place you have a grid, certainly if you have one street that is given over to pedestrians and bicycles, cars can always go on the other street. And so there should be places we can look at and say, here, when we need more open space, here are the places we can look. We can close these off to vehicles or just allow local cars on there and really not impact transportation, the auto movement or bus movement. And, I just think that's possible, and we should definitely do more of it.
Probably aren't going to get a counter argument from this group of planners on that.
This isn't a question, but we do have a comment. It says most metro areas have agencies to help introduce and set up TDM for companies, like the Tampa Bay Area Regional Transit Authority here in Tampa.
Yeah, that's a great point.
I think that's all the questions we have gotten thus far.
Yeah. Well, great. Well, thank you to both Dr. Chen and Dr. Strom for your time today and your insights on how COVID-19 will impact our communities and the planning profession. I think this has been a really interesting and insightful conversation, so thank you for that. I do think if there are folks who maybe joined late or had to leave early, I would share that the video of this will be up on the Plan Hillsborough YouTube, hopefully later this week, and we'll also feature it in our July newsletter. So if you get that, you'll get the link directly that way. Also, if there's any AICP planners, this has been registered for AICP credits, and the number is 920-2139, and that's in the question box. So if anybody wants to write it down, it makes it easier to search for it. With that, I just want to thank everyone, and hopefully everyone will stay safe, and we'll see each other in person soon. Thank you.
Thank you.